Hi, as most of you know, I'm Professor Pete Krekel. I've been a long-time PharmCon freeCE speaker, actually since 2008. I'm really excited to launch a new course for a self-care specialty course where we're going to journey through the front of my store and we're going to talk about all of the products that are available. It's going to be 20 hours long, 15 different units where we're going to focus on patient care. We'll learn a lot about the drugs, appropriate therapy, but most of all, how does that apply to your patients? Any of you that have ever read the columns that I've written about, I always talk about my dad, the welder. My dad was a welder, worked at the paper mill, and back in 1976, as I was getting ready to graduate high school, I was going to make the career choice of, do I want to be a pharmacist or even possibly engineering? So we toured Benedum Hall at the University of Pittsburgh and went to the engineering program and met up with the Department of Metallurgy Engineering. My dad, as I said, is a welder, never spent a day in college, and was talking to one of the brilliant professors there in the Department of Metallurgy, and they were talking of all things tensile strength. And back and forth the conversation went about tensile strength, and the professor looked at my dad and said, "Wow, you know a lot about tensile strength. Where did you learn all this? What university do you teach at?" My dad got a big smile on his face. He says, "Sir," he said, "I'm a welder at a paper mill." The guy says, "Well, where did you learn so much about tensile strength?" And my dad smiled and said, "Listen, you know a lot about tensile strength because you studied it. I know a lot about tensile strength because I use it." And that's what Professor Pete does. Where academia and community pharmacy meet. I teach pharmacology at St. Francis University in the physician assistant program, but I'm also a busy retail pharmacist like you are. So it's important for me to share with you the clinical aspects of that which we do. Because if we learn a lot of stuff, and it might make good pharmacy trivial pursuit, it has to apply to patient care. And that's what this self-care specialist course is all about. I think we're all really excited to see that Differin gel, adapalene gel, is available now for us to recommend to our patients. However, we also have 4 nasal corticosteroids that we need to be able to discriminate between the 4 of those. So do you know the differences between Flonase and Flonase Sensimist and Nasacort and Rhinocort? Which ones are alcohol-free? Which ones are scent-free? What age can we recommend them down to? So although we might understand how they work, what kind of patient care points do you share with your patients? Do you tell them to put their right hand to their left nostril and their left hand to their right nostril, to drink a glass of water? If it goes in your nose, you look at your toes. So I'm going to share not only the pharmacology and all of the treatment aspects of it, we're going to do a lot of patient care points. So I hope you join me for this course. It's going to be 20 hours long, it'll be 20 credits and 15 units. So this is Professor Pete Krekel wishing you a great day on the bench. Hope you can join me.